Welcome back to In the Know. We're talking all about oral hygiene today on In the Know. So let's debunk another myth. So we're not quite yet at senior care. Wine and coffee. Do wine and coffee discolor your teeth?
They stain your teeth, not so much discolor, because discoloration is usually inside the enamel, and it's not possible to remove it unless you have some dental procedures like veneers or crowns. But the wine and coffee, definitely it does stain your teeth. And it's very hard to remove by yourself. That's why you have the dental cleanings in the office.
Okay, and so is it best to do just a dental cleaning or buy like an at-home whitening kit or one of those things?
Usually it's better if you do the teeth cleaning at the office. The whitenings are great. They are usually fine to do, but they have no therapeutic issue. It's just to look whiter.
Okay, just to look whiter. All right, let's talk about seniors, because caring for senior teeth, I'm sure, is very difficult. And seniors really go from 60 all the way, as you were saying, to 97 is your eldest patient?
Yes.
Okay.
It's very hard. So, and especially, like, I mean, I know I have, like I had a grandfather, I had my father-in-law, and I know they have all these little containers that had all these medications to take. So you can imagine it took them so long to take all those medications, and to ask them to brush their teeth and floss, it's probably going to be very hard. But definitely we have to make it a little bit easier for them. So probably an electric toothbrush will really help. And definitely at that stage, you will have also partial or full dentures. So we have to teach them also how to take care of the dentures.
Right.
So probably for brushing would be amazing if they use an electric toothbrush, because they will have also dexterity issues. So probably the electric toothbrush will be a good investment. And the flossing for the senior patients will be good if they have a little bit floss holder. So they can
this
just
is like a, look at this, it's like a slingshot.
You can have the floss around, and they can floss, and they can reach also the hard areas. So it's quite nice.
So this literally, you're just going to put it up and down into your teeth.
And it's good to use it for maybe a whole arch, and maybe if they want to change it, they can just remove it, change it for the other arch of the mouth. And also for the dentures, it's quite good for them to know that they have to remove the dentures when they go to sleep. And I know a lot of them don't, but it's very important to remove the dentures so the tissues can breathe during the nighttime, because they will be very tight with the denture. It's like having a shoe all day. When you remove the shoes, you feel, oh, you know, like something feels much better. So the same thing with the tissues in the mouth. So they need to breathe. So just to have the dentures removed, they can just wash them, keep them in water, and then should be reused the next day.
Okay, and that'll help your saliva as well, right?
Course.
Like move around. Let me backtrack for the teenagers and the ones that have those retainers that you have to wear at night. If they have to wear them at night, they have to clean them the next day?
Yes, they usually have a certain brush. It's called, we call them a denture brush, because it has harder bristles, and you can just brush the retainers and keep them, like with a certain solution, just to make sure that it's clean. But most of the time, I think now the teens get the permanent retainers, because they've seen most of the patients that are especially my age or older, they usually have their teeth changed into the same position they had before braces, because they didn't wear their retainers. So it's very important that they get the permanent retainers.
Okay. Let's switch gears a little bit. We're going to talk about cancer, and many people might think, oh, you're talking about oral care. Why are you now bringing in cancer? How does cancer play a role in your oral hygiene?
It's very important to know that the oral health is connected to the overall health. So if you don't have a healthy mouth, especially prior to the cancer treatment, it can affect all the side effects that you get. First of all, they are very painful. So getting rid of all those problems that you have, it's going to make the patient feel better. Definitely it's going to save your teeth, because after it's too late to do anything probably with the teeth. And definitely it's going to, sometimes if you get a lot of infections in the mouth during the cancer treatment, you might have to delay or actually stop the treatment. And it is very important to get treatment before, during, and after the treatment. And I usually say, if a patient is going through cancer treatment, please make sure that you have a dental professional part of the cancer team. So, and we usually, it's important. I think now things have changed, and definitely they are putting the dental professional part of the cancer care team. Things have changed quite a lot in that sense.
Okay, so if you are unfortunately diagnosed with cancer, make a visit to your dentist or your dental hygienist.
First, yes. And they will evaluate your mouth and give you all the treatment options that you have to do prior to the treatment, and then they will have to go through the chemotherapy or radiation. Some of the things that they have to do prior is definitely getting a teeth cleaning, and then restoring any crowns, bridges, probably removing any infected teeth, any fillings, root canals. Whatever needs to be done prior will have to be done before you do anything.
So pretty immediately after diagnosis then.
Yes.
Does your oral hygiene change at all after cancer?
It definitely does, because during the treatment, especially if the patient is getting radiation into the head and neck area, it will damage the salivary glands, and the patient will have extreme dry mouth. And saliva is vital to the oral health. So if you don't have saliva, you are going to get cavities, you are going to get infection, and definitely you're going to get all the bad stuff that you can imagine in the mouth. So that's why it is so important for the patient to have good oral health care, and to definitely have a good diet, no smoking, and a good oral hygiene at home.
How can you induce that saliva, or is there a way to induce additional saliva?
So there is some, and I actually brought some, these are some candies with xylitol. That's very important because it's not with sugar.
Okay.
So you can have some saliva substitutes, or sometimes gum with xylitol will also help to produce a little bit more saliva. If it's too extreme after, probably you will have to get some prescription saliva substitutes.
And lots of water.
And lots of water.
Everyone's telling us, drink our water.
Lots of water. Water is very important, not just to the mouth, but to our overall health.
All right. Thank you, Anaida. For people who are watching the show and they want to learn more about this, and they're saying, we really got to get a handle on our oral hygiene, how do they find you?
They can find me on the website, is DentalX.ca, or they can find me on AnaidaDeti.com.
All right. Thank you so much.
Thank you.
We've come to the end of our show. Thanks to everyone at home for watching. We'll see you here next time on In the Know.
Thank you.
Good stuff. Thank you.